What exactly does respiratory rate mean when your patient is on a ventilator? It is one of the most fundamental settings we adjust in the ICU to manage gas exchange. Understanding the rate is the first step in mastering mechanical ventilation and ensuring patient safety. Respiratory rate is the specific number of breaths the machine delivers every minute. This setting directly controls the removal of carbon dioxide from the bloodstream through the lungs. As the rate changes, it alters the minute ventilation, which is the primary driver of CO2 levels. Adjusting the rate is a precise intervention. A higher rate removes more CO2, while a lower rate allows it to build up. Remember the golden rule that respiratory rate primarily controls ventilation and CO2, not oxygenation levels. Always monitor your arterial blood gases to determine if a rate change is necessary.